When most of us hear the word trauma, we picture a very specific setting. We think of soldiers returning from a combat zone, carrying the heavy, invisible weight of war. But severe trauma routinely happens thousands of miles from any battlefield. It happens on our commutes, in our homes, and in our local hospitals. People survive horrific motor vehicle accidents or endure the quiet, persistent danger of intimate partner violence. Others go through terrifying medical scares, severe childbirth complications, and the sudden, tragic loss of a loved one. Because these survivors don't fit that traditional military profile, they rarely recognize their own symptoms. As a result, post-traumatic stress disorder goes chronically underdiagnosed in the general public. Instead of seeing a medical condition, everyday survivors often internalize the struggle. They lie awake at night feeling like they are simply failing to cope, or worse, that they are permanently broken. This blind spot extends straight into the medical community. Primary care providers and community partners frequently miss the signs of PTSD in their non-veteran patients. Millions of people are currently trying to manage an exhausting condition on their own, completely unaware that their suffering has a name and a highly effective treatment. Clinicians define the exact threshold where the echoes of a difficult life event qualify as a diagnosable medical condition. This chart shows the first crucial factor: time. If the mind refuses to reset and symptoms persist past 1 month after the inciting event, the diagnosis shifts. To formalize that shift, the DSM-5 breaks the condition down into 4 specific categories of measurable symptoms. First, a patient will experience intrusive memories or flashbacks, feeling as though the event is happening right now. Second, they will actively avoid any places, people, or thoughts that might trigger those memories. Third, they will experience severe negative shifts in their overall mood and cognition. And finally, they will suffer from chronic hyperarousal, a state where the nervous system is locked on high alert and simply won't rest. A survivor meeting these specific criteria past the 1-month mark is living with the structural reality of PTSD. Because PTSD is a recognized structural diagnosis, the medical community has developed highly specific evidence-based treatments to resolve it. Clinicians rely on tools like EMDR, eye movement desensitization and reprocessing, along with cognitive processing therapy and prolonged exposure. These are targeted clinical interventions designed to actively process trauma, and they produce remarkably strong outcomes for patients. Receiving a PTSD diagnosis doesn't mean you are stuck this way forever. It provides the exact roadmap required to apply these proven therapies and actually heal. Even with these effective treatments available, the logistical challenge of connecting them to the population remains. Let's look at how this problem is being addressed right now in the state of Georgia. A practice called Coping and Healing Counseling, or CHC, is bridging the gap by offering 100% HIPAA-compliant telehealth care. They provide same-week intake appointments, and their virtual model reaches patients in all 159 counties across the state. CHC backs up that reach with clinical strength. They employ a diverse, culturally competent team of over 15 licensed clinical social workers, professional counselors, and marriage and family therapists, all specifically trained in trauma care. By operating entirely through telehealth, this model removes the long drives and impossible scheduling conflicts that usually stop everyday survivors from getting help. That leaves one final, massive obstacle: the out-of-pocket cost of specialized therapy. To solve this, CHC has structured their practice for maximum financial accessibility. For patients using Medicaid, the copay is exactly $0. They also accept major commercial insurers, meaning sessions run between $10 and $40 for patients with Aetna, Cigna, Blue Cross Blue Shield, United Healthcare, and Humana. If you recognize your own experience in any of this, you can take the next step by reaching out. You can call CHC directly at 404-832-0102, visit chctherapy.com, or email their support team. Everyday trauma is real, and the clinical recovery is real. With the geographic and financial barriers out of the way, you no longer have to carry this alone.